Hi, my name is Krista Elza, and this is my nurse practitioning assessment video. To start, I've already washed my hands, and we have assessed the patient's cranial nerve number 2 by having him do a visual acuity with a Snellen acuity chart. Hi, my name is Krista. I'll be the nurse practitioner assessing you today.
I'm John.
Nice to meet you. All right, so to start, I see that he's awake and he's alert. Times 3, do you know the month that we're in?
September.
What year are we?
2016.
And what's the month that we're in?
September.
Perfect. He's awake and alert and oriented. So I'm going to start by assessing his hands. I'm going to look at his nails, check for cap refill, check for any signs of clubbing, and all is good. I'm just going to do a quick overview of his skin to make sure that there's no lesions, check the turgor, that he's not overly dry, and so far everything looks okay. Next, I'm going to check his radial pulses on both sides. And that's good at a point at a +2, what we would expect. And the same over here, +2, what we would expect. Next, I'm going to check his brachial pulses. +2. And a +2. So next we're going to assess the range of motion of his upper body. We'll start with the hands first. Go ahead and, let me see your hands like this, okay? Go ahead and flex them up, extend them down, open your hands, your fingers, and close your fingers, okay? Go ahead and now try to keep, on both hands, try to keep them closed. Good. Okay, and so for your wrist, go ahead and put your wrists out. Go ahead and flex for me. Down this way. Go ahead and bring your hands out and in. Great. Now we're going to go ahead and check your elbows. So flex them, extend them. Go ahead and pronate and supinate. Okay, great. Now we're going to try your shoulders. For your shoulders, I want you to lift your arms out. Put one arm across. Go ahead and put it down. Out and across. Good. Go ahead and lift them forward. And I know you're going to brush behind you, but go ahead and flex them back. Perfect. And he's got good range of motions in his fingers, his hands, wrists, and his shoulders. Next, I'm going to have you flex your shoulders up for me. Try not to put them down. Good. Okay. Shrugging his shoulders, it's going to, against resistance, will show me that his cranial nerve 11 is intact. So I'm going to check his reflexes in the arm. So we will try, let me see, go ahead and put your hand up this way. I'm going to check his brachial, his tricep, and his brachioradialis tendon here. I'm going to use this as my flexion hammer right now. So go ahead and just relax your arm. Good. And I'm going to go ahead and assess the other side right away. Relax your hand. And now we're going to try the tricep on this side. And then the other side. And finally, we'll do the brachioradialis on this side. Just relax your hand. Good. Okay. And brachioradialis on this other side. Good. Okay. Now that we've done that, we're going to do a couple of things just to test your coordination. I'm going to have you do a rapid movement test. So place both of your hands on your knees. Open your palms. And back down again. And go back and forth quickly. Good. That's perfect. Next, I'm going to have you draw your finger to your nose. So finger to your nose. Again, on the other hand. Go ahead and close your eyes and do that for me. Perfect. One more. Good. The last one is, I'm going to check your stereognosis test. And so I'm going to have you open your right hand. Close your eyes. I'm going to place an object in your hand. Close. Can you tell me what it is?
Feels like a marble.
Perfect. Right. Another object, go ahead and put it, same hand. Okay, close your eyes.
Feels like a coin.
Perfect, it is. And last object, go ahead.
Feels like a key.
Okay, great. Let's try this on the other hand.
It's a key.
Perfect. And one more.
Marble.
Perfect. Okay. I'm going to check a couple of the nodes in your arm. Right here. I'm going to go ahead and check your epitrochlear node here on this side. And I do not palpate nodes here. I'm going to go ahead and check your axillary nodes in here. And there's no swelling to those nodes either. I'm going to try this side. And axillary. Perfect. Okay. All right, now I'm going to start my head to toe assessment. I'm first going to start with the head. I'm just going to inspect first the skin, the hair. I'm going to go ahead and palpate if that's okay. So I'm going to palpate the scalp. It moves freely. I don't feel any nodules, any deformity. It's symmetrical. I'm going to go ahead and look at the scalp. I see no lesions. The hair feels normal in texture. It's not overly dry. All right, I'm going to go ahead and look at the face. I'm going to palpate the sinuses here. And the maxillary sinuses here. Good. And I don't see anything there. I'm going to go ahead and check cranial nerve number 7 by having you frown. And then puff out your cheeks for me. Perfect. And both are symmetrical. And then next I'm going to palpate the temporal arteries here. And I'm also going to assess the temporal artery just to make sure there's no bruit present. And that's normal. And to assess the cranial nerve number 5, I'm going to go ahead and close your eyes. Let me know when you feel. Do you feel anything on your face?
Yes.
Okay. I'm gently touching his cheeks. And what about this side?
Yep.
Okay. And he feels the light touch, which would indicate that cranial nerve number 5 is intact. Next, I'm going to go ahead and take a look at his eyes. I'm just going to inspect the eyes right now. They are both symmetrical. The eyelashes face outward. None of the lids are facing down. I can't see any of his conjunctiva as I'm just looking straight at his eyes. First, I'm going to check that his cranial nerves number 3, 4, and 6 are intact by assessing the 6 cardinal fields of gaze. All right, so just follow my hand. Across. Up. And down. And both of his eyes moved together, and there was no nystagmus noted on either side. Next, I'm going to assess, again, cranial nerve number 3 by checking your pupils and ensuring that they are both equal and reactive. Okay? And looking at his right side, it's reactive, and I also see consensual movement and constriction on his left. I'm going to check your left pupil, and it is reactive, and there's consensual constriction on the right-hand side. His pupils are equal, they're round, they're reactive to light. Okay, and so that'll go ahead and tell us that his cranial nerve number 3 is intact. Next, we're going to try the cover and uncover test. So what I want you to do is, I'm going to, can you see me here? Okay, so I'm going to have you cover your right eye. Cover your right eye. All right, and just look at the wall behind me. Okay, go ahead and remove the right eye. Good. There's no movement in the other, on the opposite eye when he uncovered. Go ahead and do the next eye. And release. And again, there was no movement with that. So his, there was no movement of either eye there. All right, so next I'm going to look at your eyes. I'm going to look at the conjunctiva. It's pink, moist. The sclera is white. The vessels look normal. His lids cover right at the top of his iris. There's no lid lag there. So now I'm going to do, I'm going to look with the ophthalmoscope inside of the eye. Okay, so right now I'm going to go ahead and look into your right eye. All right, and I can visualize the retina. And the disc is round with sharp margins, and vasculature looks normal within the retina. The other side, go ahead and look. All right, and I can see the retina. I can see the optic disc, which has sharp borders, and vasculature looks normal on the side of the retina. Lastly, we will go ahead and check for the red reflex, so go ahead and look this direction. And both corneas exhibit the red reflex, which tells me that his eyes are correctly aligned. Both are aligned the same. All right, we're going to move on to the ears. First, I'm going to inspect with your ears, which both look normal. There's no deformity. They're both in good line with the mid-eye there. So we're gonna test cranial nerve number 8 by doing the whisper test. And to do that, I'm gonna stand behind you here. I'm gonna say 3 things, and I want you to repeat after me when you hear them, okay? You can say it in a normal voice. I'm gonna whisper, you say it in a normal voice, okay?
Bee.
Good.
Cat. Dog.
Perfect. Okay, I'm gonna go to this side. Oh, I'm sorry. You know what? Let's repeat that test. I want you to go ahead and plug your opposite ear.
Okay.
There, let's try this again, okay?
Giraffe. Elephant. Cat.
Perfect. Okay, other side. Go ahead and release the hand. Next one, I'm gonna go ahead and say 3 things.
Bat. Crab. 3.
Perfect, okay. All right, and next, to go ahead and test your ears, I'm gonna do the Weber test. And for that, we're gonna use my, we're gonna test your Weber test, yes. So I'm going to strike my vibrating tuning fork, and it's gonna go right in the center here. I want you to let me know when you can no longer hear it, and if it ends quickly, or sooner on your right or your left, or if you hear them equally. Can you hear them both, or one or the other side better?
Both.
Both, perfect, okay. Now we're gonna try the Ren test, and to do that, I'm gonna go ahead and strike my tuning fork. It's gonna go right behind here on your mastoid process. Let me know when you quit hearing that.
Okay.
Done?
Yep.
Okay. And then I'm gonna go ahead and test hearing here. Let me know when it stops.
Okay.
Okay. And the amount of time that the conduction test, he could hear it 2 times longer outside here versus here with the bony touch, which means that was a positive test. I'm gonna go ahead and turn on the side. Touching the bone conduction here. Tell me when you can no longer hear it.
Okay.
And then we're switching to air conduct.
Okay.
And it was also double the amount of time, which is what we would expect to find on the Ren test. So now I'm going to go ahead and inspect the inner ear. All right. So I'm going to go ahead and look inside the ear. I see a gray, opaque tympanic membrane with a positive bright light reflex at the bottom. Good. And the ear canal itself looks pink. Other side. No nodules or evidence of swelling inside. The next ear. All right, and I see a gray, opaque tympanic membrane with a positive light reflex. And then again, the ear canal is pink, no nodules or signs of inflammation on the inside there. Okay, so we're going to move on to the nose. I'm just going to take a look at the nose. The nose is symmetrical. I'm going to palpate the top. There does not appear to be any sway from the right or to the left. It's all straight and aligned. I'm going to go ahead and take a look inside your nose, which the patency of the nares would be positive sign for cranial nerve number 1. And inside the nares, it is normal, pink, clear mucosa, and the turbinate is open and intact. Go ahead and look on the other side. And the mucosa is pink, clear mucosa, clear drainage, and it is also patent and intact. All right, we're going to move on to the mouth. I'm just looking at his lips. They're not overly dry. Mouth is symmetrical. One side is not drooping more than the other. I'm going to go ahead and first inspect the inside of your mouth. All right. Open. And the mucosa is pink, moist. We go ahead and look in the back of your throat. Go ahead and say ah. Okay. And his uvula goes up when he says ah, which tells me that cranial nerve number 10 is intact. Go ahead and let me open your mouth wide again. He no longer has tonsils, I can see that. And there's no erythema present or swelling in the throat. Go ahead and open your mouth one more time for me. Let me just see your tongue at rest. Good. And the tongue is not atrophied, and there is no fasciculation of the tongue, which tells me that cranial nerve number 12 is intact. Go ahead and stick your tongue out for me. Straight out. Be able to do that? Okay. And that tells me that he can stick his tongue out. His cranial nerve number 9 and 10 are also intact. Okay, I'm going to test the strength of your tongue. So go ahead and put your tongue against the cheek here. Good. And the other side. Good. I'm also going to assess this, the TMJ joint right here. Go ahead and open for me. And close. Any pain there?
No.
No pain. And there's also no popping or abnormal movement when he opened that jaw. Last, I'm going to go ahead and look at this hard and soft palate. And that looks normal and intact. Normal, moist, pink mucosa along the soft and hard palate inside. Go ahead and swallow for me. One more time. Good. And the swallow is intact as well. So next we're going to move on to the neck. I'm going to assess his neck. It's symmetrical. I don't see any lumps, lesions, and there's no pulsating along the neck here. We're going to go ahead and check the nodes. There's quite a few nodes here. We're going to check the preocular, right up here, preauricular, the posterior auricular nodes. There's none there. On both sides. Okay, we'll do the submandibular nodes here, the tonsillary nodes here, and they're good. We'll do the submental nodes here, and the superficial cervical, the deep cervical, and then finally the occipital at the back. And all are good. All right, I'm going to go ahead and palpate his carotid pulse on one side. And that's good. And it's a +2 on both sides, which would be what we would expect. I'm going to go ahead and auscultate it this time, just to note any bruise. I'm going to go ahead and palpate his thyroid at this time, so I'm going to go on either side of the cricoid cartilage here. Okay, I'm going to just slide this to the right, go ahead and swallow. Good, and the other side. Okay, and I see a good upward movement here. Go ahead and relax. And there's no tugging noted either at the thyroid at rest. Okay. All right, so next I'm going to go ahead and check the chin to your, push your chin against my hand, the strength there. Good, and the other side. Good. We're going to check the range of motion of your neck. So go ahead and put your left ear to your left shoulder. Don't bring your shoulder up, just your neck. And the other side. Go ahead and lean back, bring your head neck back, neck forward. And then turn to your right. Oh, I'm sorry, go back up. Turn to your right, and turn to the left. You've got good range of motion there. All right, and again, we've already checked the cranial nerve number 11, but let's try it again. Go ahead and shrug up against resistance, and that's good. He's showing strength in his shoulders upon shrugging, which is good. All right, so now we're going to move on to the posterior chest. I'm going to just observe for any he's symmetrical here. There's no use of his accessory muscles. He's calm and at rest. And then I'm going to go ahead and palpate for any nodules. I'm also going to look for scarring, make sure I don't see any scarring here, here, or here that may indicate surgeries or trauma of any kind there. All right, next I'm going to go ahead and listen. Auscultate to 6 fields. I'm going to go ahead and start it here. Deep breath for me. Over here. I'm going to go ahead and test for tactile fremitus. Go ahead and say go.
Go.
Okay.
Go. Go. Go.
And there's positive vibrations throughout all the areas here. The next thing we're going to do is I'm just going to percuss over the fields in between the intercostal space. In between the intercostals here. Good. Okay. I'm going to go ahead and move to the back. And here I'm going to check for chest expansion. And the way I'm going to do that is I'm going to go ahead and press with both of my fingers here. I'm going to squeeze tightly and then I'm going to have them take a deep breath. Take a deep breath for me. Okay. And my hands on equal sides go out with the breathing and come back in, as you would expect to find. I'm going to auscultate back here and listen. Go ahead and take a deep breath for me. We're here and out. Good. Good. And as lung sounds are clear, go ahead. I'm going to go ahead and check the lateral. Which helps with the right lobe. Go ahead, right middle lobe here. Okay, and as lung sounds are clear, there's no wheezes, rails, anything like that. I'm going to check also for egophony here. Go ahead and say go.
Go.
I'm sorry, say E.
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 E. E. E. E. E.
Good. And it does sound like E as opposed to A, which would be a negative sign. I heard E the whole time. I'm also going to go ahead and check for any CVA tenderness right here. Go ahead and let me know if this causes any pain. No?
No.
Good. Okay. Move back around. I'm going to go ahead and we're going to check the heart rate now, the chest, the front chest. We already auscultated 4 locations on your breath sounds. So we're going to move on to the cardiac portion of the chest. I'm going to go ahead and feel the pericardium, the precordium here with my palm. And his rate is regular. Okay, I'm going to listen to his heart sounds. First, I'm going to listen to the aortic valve, which would be on the second intercostal space on the right-hand side. Okay. And it's a regular rate and rhythm. No heart murmurs there. I'm going to check the pulmonic valve, which would be more on the left side of the second intercostal space. And again, normal rate and rhythm with no signs of murmur. I'm going to check Erb's point, which gives you a better sound of the S2. And it's usually found around the third intercostal space on the left side. And again, that's normal rate and rhythm. I'm going to check the tricuspid valve, which is fourth intercostal space on the left side. And no murmur heard there. And then finally the mitral valve, which can be heard best at the apex. That's normal rate and rhythm there with no signs of murmur. I'm going to go ahead and switch it over and listen to the same locations with the valve. The aortic valve here. The pulmonic valve here. Erb's point. Let's tricuspid valve here, and mitral valve here. And all sound normal with no signs of heart murmur. All right, we're going to move on to the abdomen. So I'm going to have you go ahead and lay down for me. Okay. And while he's lying down, I'm just going to go ahead and take a look at his skin. Just noting any lesions, skin turgor, any noted palpitations or lumps, anything like that, which I don't see. First, before we do anything, after I've inspected, I'm going to go ahead and listen. I'll still take vowel sounds on all four sides, all four quadrants. So I'm going to listen to his right upper quadrant. Positive sounds there. Left upper quadrant, right lower, and left lower. Okay, and while I'm here, I'm going to go ahead and assess the vascular area of the abdomen. Right about above the umbilicus, I'm going to go ahead and listen here for the aortic, the aorta here, the descending aorta. Okay, and then I'm going to move down further here where it bifurcates. And then get on the other side. And then finally here, I'll go ahead and check his femoral pulses. And again here. And all those are +2. There's no bury noted in any of the vasculature there. All right, next I'm going to percuss all four quadrants. Again, most of this should be open air. You should have tympani here. Good. Okay. And then I'm going to do a light palpation to all four areas. Okay. And I'm going to do a deeper palpation. And here on the right hand side, go ahead and take a deep breath for me. With the deep breath, I can feel the margin of the liver here and out. Okay. And then a deeper side on the left-hand side, I do not palpate the spleen, which would be a normal finding since it should be up underneath the rib cage here. And go ahead and palpate low here and low here. And with palpation, I don't feel anything abnormal, no lumps, and there's no tenderness. All right, go ahead and swing around. We're going to do your legs, so go ahead and slowly sit up. Okay. All right, and so for the legs, we're going to go ahead and palpate the legs first, and make sure, Adam, do you mind pulling that back for me so we can see the legs? I'm going to adjust the camera just a bit so you can see what I'm doing here. With the legs, we're just going to go ahead and check for the skin. Hair is equal on both sides. Just upon inspecting, there's no edema. The skin is normal in turgor. There's no moisture there. I mean, there is normal amount of moisture here, okay? And no swelling. All right, so I'm going to go ahead and check the pulses here. Tibial pulse. All right, and that's a +2. And then I'm going to go ahead and check the dorsal pedis pulse here, which is also a +2. We're going to go on this side and check his pulse here. +2, and then also here. Good. Okay. Next, we're going to check the nail beds, and they're pink, which is good. Okay. We're going to check some range of motion strength. So I'm going to have you go ahead and lie down one more time for me. Before we go any further, I'm going to check the nodes, the inguinal nodes first. And on the other side. Okay, and there's no inflammation there in the inguinal nodes noted. Okay, so we're going to check the range of motion of the hips and the knees while he's lying down here. It might be easiest for you to go ahead and roll towards me on one hip. Okay, to assess the hip, we're going to go ahead and do a forward motion. So if you can, we're going to bring your hip forward here, and then flexion will be back here. Good. Okay, and then extension will be out. Can you lift it straight out? Good. And then we'll go across here for the adduction. Any pain there?
No.
No. Okay. And then we're going to go ahead and try that for the other side. So if you can, just roll onto your other side. Okay. And you're going to go ahead and bring that hip forward. Good. And back. Can you do it without bending your knee? Just straight back. Okay. And then just center line, now straight up. Okay. And then again, forward, crossing your body this way. Good. And he's got a good range of motion of the hips. Go ahead and turn that on your back. All right. And here we're going to check the knee. So we'll do flexing the knee. Bend, flex, extend. Good. And then I'm just going to go ahead and pull his knee out this way. Oops, I'm sorry. Is this any pain on the out?
No.
And then adducting. Any pain going in?
No.
Okay. We're going to try the other side. All right. So then you go ahead and flex. Good. And extend. And then we're going to do some adduction here. Any pain when I pull this way?
No.
All right. And any pain this way?
No.
Good. Okay. All right. So go ahead and sit on the side of the bed one more time. We're going to check your reflexes in your legs. If you sit on the side of the bed for me. Okay. So we're going to check the reflexes, the patellar reflex, and also the Achilles reflex here. All right. So just relax your leg. And the other side. All right. We're going to try the Achilles. And the other side. Right. And both reflexes are present. All right. And finally, we're going to try, we're going to do a few tests walking. All right. So I'm going to have you stand. All right. And so just go ahead and turn this way. All I want you to do is walk straight and then walk back to me. And I'm just watching to make sure that his hands and arms and legs move together, and his hands are moving with the legs, and there was no wobbling with the walking. All right, next, I'm going to have you walk again, but I want you to put your heel to your toe like you're walking the line, okay?
Okay.
You're walking on the line, so heel to toe, heel to toe, heel to toe, heel to toe, heel to toe. And his balance is steady, which is good. Go ahead and turn towards me. Go ahead and walk to me.
Same way.
That's okay. That's good. All right. And so now I'm going to go ahead and have him stand towards me, face me. All right. Go ahead and lean back onto your heels. Good. And then lean forward on your toes. Okay, good. And he was able to hold his balance doing that. Next, we're going to do the Romberg sign, which is you're going to stand this way. I want you to put your feet together, completely together. All right. And I'm just testing to make sure that his balance is intact as he's standing there. Now go ahead and just look straight ahead, but close your eyes. And I'm just noting any swaying, which there's none. All right, so your Romberg sign is good. Go ahead and do just like a shallow knee bend. Any pain there?
No.
Okay, and he's able to do that as well. All right, finally we're going to check the posture of the spine. So I'm going to have him turn this way. I'm just inspecting him to make sure that the scapula, the hips, the legs are all symmetrical, and they are. I'm going to go ahead and palpate back here. The scapula are equal. Go ahead and bend down for me. Touch your toes. I'm just going to check for the alignment of the spine, the alignment of the hips, and that they are at the right spot. The gluteal folds are also connected, and they're also at the same location and height. And then finally, we're going to go ahead and check the range of motion of the spine. So go ahead and stand up. Okay, flex backwards for me. Okay, and forward slightly. Okay, and then I want you to twist to the right, twist to the left, and then finally do a side bend to the right, and a side bend to the left. All right, perfect. Go ahead and sit down for me. All right, and that concludes my assessment for today. Thank you for being here.